wearing some kind of a facial covering.
Mm-hmm.
So I went to the grocery store yesterday morning during the old people hours, and there was 20 of us in line waiting to get in, and all of us are wearing handkerchiefs. We look like desperados.
It's going to be our new normal, right?
Yeah, right.
Yeah.
All right. Well, it's 1 o'clock. I did start the recording. We'd like to record this for our colleagues who aren't able to join us today. So when you see your little note pop up, just hit continue. We are watching our chat box here. So if you have some questions and things you'd like to share with us, please go ahead and do that. We're very thankful to have the conversation continuing here. This focus today, helping to keep our providers safe, how Simulation is working on strategies for training and providing personal protective equipment, otherwise fondly known as PPE to all of us. We've invited several people who are innovators in this area. They have been posting their ideas and sharing their updates on how they're trying to get the right training tools out there to our providers on the front lines. So we've invited a few of them, but certainly not as many as we know are out there. I hope we've been able to reach many more of you who are providing innovations and ways to train, and we'd like to have you pipe in and join us. We've stacked up the front part of this with 3 innovators who are working on some tools that are all available to you and would like to be able to share those. And then we're going to open it up and ask you for your ideas, what barriers you've found in training and other things that you might be able to contribute to the conversation. So thanks for joining us, and we will get started. I would like each of our presenters, once they begin to share kind of what sorts of things they've been able to develop, to just give any disclosures they have so that everybody knows who's working for whom. All of the resources that we're talking about here today are free and available to everyone on the entire community. So we hope you'll be able to find those. One of the things that we will go ahead and put in the chat box are the CDC guidelines on PPE donning and doffing. I'm sure you all are very familiar with all of these, but we felt it would be important to have those up front as we get started on this conversation. One of the questions we've been talking a lot about is how can we train providers without using the valuable equipment that we need to give to them? How can we do the training without using up that extra equipment and providing some deficit there? And one of our colleagues through the Eastern Virginia Medical School, Bob Armstrong, whom I see was able to join us today, thanks Bob for being here, partnered up with eTrain to come up with a virtual training tool that can be used. Bob has been sharing this widely, but we wanted to make sure everybody has access to this. And I'm going to turn it over to Bob and to Bill Cornelius from eTrain to just tell us a little bit more about what came on with that. Bill is prepared. Bob, you may not be, but I'll let the 2 of you share what you've learned through this.
Great. Actually, Bob, you might want to start since,
Sure.
You're at a higher pay level than I am.
I don't know about that. So hi everybody. Bob Armstrong, SSH president and the director of the Centera Center for Simulation and Immersive Learning at EBMS. Kathy just did something to the display and completely freaked me out. So
sorry, Bob. I just wanted to get this up on the screen. I had a PowerPoint up that I was forgetting to show, so there we go.
It's all good. I wasn't sure. I thought I might have lost my connection. It scared me. So as soon as we heard at EVMS, as soon as we heard that this, coronavirus had made its way to the United States, and we were starting to see some the preparations get made, Dr. Len Weyrider, who is a trauma surgeon, I think he used to run the trauma surgery program for the American College of Surgeons. He happens to be my medical director at our STEM center. And he said, hey, our level 1 trauma center, which is directly across the street from us, he said, they're struggling to remember what it is they need to do for donning and doffing PPE. And that makes sense because 9 times out of 10, we don PPE really just to stay clean and to worry about bloodborne, just normal bloodborne pathogens. I mean, it's not a super scary thing, but a scary thing nonetheless. But then when COVID-19 shows up and we've got some really specific guidelines about how we want to cover And then you start thinking about how donning is certainly important, but doffing is really, really important, because that's where the self-contamination tends to happen. Dr. Walrader said, hey, we need to figure out a way to develop some training on this. And I'm a customer of eTrain. We actually purchased the software system not too long ago. We're still developing our capability using the tool. But I called Bill and his team and said, hey, we think we've got a really good topic here that needs to be put out there. And so in pretty short order, really probably about 10 days, we collaborated. We shot the videos according to the CDC guidelines that existed at the time. Bill did his part to incorporate those videos as part of the guidelines into a micro simulation program that eTrain has, that has since been provided as a free resource to pretty much anybody across the world that wants to get access to it. I checked this morning. I think we've had more than 1,000 people actually use the training at this point, and maybe the number's even higher than that now. But that's what kind of got us to where we're at right now. And it was a relationship, both a business relationship and a personal relationship, that I developed with Bill and his team, that enabled us to come together super quick and to trust each other that we were going to get the job done on this really well. So, or at least I hope it's really well. We certainly think so. So Bill, you want to take it from there and talk about what you guys did?
Yeah, thanks, Bob. And I also want to mention Andrew Cross, who's also here. He played a very big role in the project management and development side of this, as well as the team at eTrain. We're a small company. We're a virtual company, so I'm headed out of Sarasota, Florida, but we've got team members all over the country, and some in India as well. So based on Bob's point, we thought this was just too important to not, deliver. So eTrain has an authoring platform that really anybody in this virtual classroom can use it and build training and simulations, right? So the design was there. It's just understanding the sequence and essentially what we're teaching all just has to be entered into this tool. So this donning and doffing module was designed really to do two things. One is have a video to enable the average provider to take a look at it and see exactly how donning and doffing is as it relates to the CDC guidelines. And we've been getting some comments about, well, you need to add this, you need to add that, because our system does this. So we've really tried to keep it specific to CDC. If organizations have additional, process, et cetera, they can absolutely, add that to, the module in the future, things like that. But I think our goal was to really stay true to the CDC guidelines. And moreover, if they do change those recommendations, there's rumors that there might be some new changes. We have the ability to go in, make those changes within minutes, depending on the change, and then offer the same link and same version of the application. So the goal was you watch a video, and then, the real big goal was now it's your turn to actually don and doff on the virtual provider. And you simply just make decisions. And what we've added that's different, I think, is not only make the decision that you're going to, wash your hands first, X, Y, and Z, but how confident are you in making that decision? And what we're seeing is there's a lot of confidence. The confidence levels were over 90% on the decisions people are making as it relates to PPE. Which I think is a good sign, but there's also some people that were very confident, but they didn't get the sim done correctly. They didn't follow the right order. So hopefully it's been a great learning experience for everybody going through it. We've had nothing but great comments in terms of the learning initiative. And the goal is at the end, there's additional references, and here is a debrief report that shows your performance, both knowledge acquisition and performance in a simulated environment. But then also there's a test. There's a small 4-question quiz.
Bill, thanks. That is a great overview. And Bob, thank you very much. We have a couple of other, obviously we have quite a bit we want to get through today, but I wanted to make sure that you all knew about this resource. Bill, tell them a little bit about how you're partnering with different centers.
Yep. So what we're looking to do is, well, first of all, I will say this, there's a lot more work to be done on COVID-19. We're a small business. We're going to do everything we can to try and get the training out there. But unfortunately, we're like most small businesses during this time. Things are difficult for everybody. But I will say that we're hearing a lot of interest in additional modules as it relates to, decisions maybe that providers need to make related to ethical considerations for ventilators, or the proper cleaning and disinfection process, cleaning an N95. These are all topics that I think we can help in the future. So really any institution that wants to author their own micro simulations, because these are micro simulations that can run on your phone, your tablet, anything. We've got an authoring tool with a library of rooms, patients that people can self-author training, and the mission is really about improving safety. So that's really how we work with organizations across the country.
Okay, let's open it up for some questions on some virtual training here. Virtual training questions for Bill, Andrew, Bob, anybody on that would like to ask some questions. Give everybody a minute to make sure they know where their mute button is, although I think we're all Zoom experts by now. Anything for the team on some virtual sim training? Again, we'll have this link in the chat box so that you can all get to it, and it is free for all of you to use right now. I think Sean Cavanaugh was telling us earlier on the SOTS call that they've been using it pretty effectively with their providers, and he's in New York. Certainly a hot spot for the disease right now.
I have a question.
Yeah, go ahead.
I'm Megan Jones. I'm in Auburn, Alabama. And I have one of our clinical partners at the local hospital. I've sent her the link to this training, and she's an educator at the local hospital, and she was interested in using this, but she had some issues getting through using her hospital email, I guess, because of some of their protection, that's in place using the internet and everything. And so she wanted to reach out to one of to the appropriate person to talk to how she could get around that for her staff. So who is the best point of contact if someone is running into issues with this training?
Yep. Hi, this is Bill. I think the challenge, some organizations may have, right, is if they want to put this learning initiative on their learning management system, that's something that's more of a technical thing that we would have to discuss, and it's a time thing, so there might be a small cost associated with that. But I would highly recommend different browsers. If somebody's accessing it on their phone, which they can, just through Safari and Chrome browser on your phone, there should be no issues with access.
Okay. Thank you.
Yep.
Okay, any other questions on the virtual training? Okay, cool. We're going to go on. Jose Perez is on the line. He had been posting at SimConnect, poor guy, and I found him in there and said, hey, Jose, join us for our discussion on Thursday and share what you've got. And Jose, would you like me to put up your PowerPoint, or is there anything in particular you'd like me to start with?
I don't know if you have any stills of the YouTube videos.
Let me find those. Yeah, go
You
ahead.
don't necessarily have to play it.
Yeah, I'll.
Yeah, let me see.
It.
I am doing Zoom from my car because we can't get access to Zoom. I work for the VA, and so you can imagine the firewalls. I'm here at the VA hospital in Pittsburgh, Pennsylvania. Here in my site, I was tasked with getting PPE training together, but like almost all hospitals, without using the actual PPE. So a fun, creative challenge. So I posted a couple of videos onto SimConnect. I made some step-by-step DIY how to make the mock PPE that I've put together. You can see there, that's just a patient gown that we're using for the PPE gowns, because it can still come off from the back. We can still practice. The whole point of all of the mock things that I made was to give a chance to go, the staff to go hands-on, that they can practice some of the muscle memory, especially now that as the guidelines we're getting, at least locally, are getting updated to include the reuse of our face shields, disinfecting the face shields, reuse of the N95s. They've given us some particulars of how to retrieve it from a bag, how to take it off one-handed, things like that. That's sort of the reason why I wanted to make sure that they got a chance to physically work with the things, because they can be tricky, and inevitably in every single training I've been running, very specific questions come up. What do I do when it's like this? What if it looks like this? What if I see a little tear? How do I inspect this without touching the inside? Things like that. So it's been seeming beneficial to have the mock equipment. I think you were all still able to, there we go. So you can see a bit of the equipment. So for me, the objective was to be able to create the mock PPE with things one could find around the house or around the hospital. Not as specific to a hospital, because I wanted it to be things almost anywhere with office supplies somebody could make. I didn't want to make sure that they had to be at a hospital. So most of these things are made out of paper towels, are made out of duct tape, and rubber bands. Rubber bands, masking tape, and paper towels has been the main things I've been using. So I don't have any disclosures, but that is the thing I've been using the most. Maybe they're seeing their stocks go up.
Thanks, Jose.
Yep.
He's also got a PowerPoint here, Jose. I don't know if you want to share that with the rest of the webinar here. We could probably get these slides out. But this is just kind of a nice way to go through.
I'm happy with any of the things I gave to you for other people to have. Yep.
Okay, great.
These are just slides that we're using in the PPE training I'm running here at our site. And most of it is information from our infection prevention.
Okay. Let's have a discussion about creating your own training tools so that we're not using inventory. Anybody else got some experience with this right now that they'd like to share? And Jose's also done a YouTube. We'll go ahead and post this in the chat. It's also done a video for you as well. Okay,
I have a question for Jose. Where do you find paper towel these days?
It started with me having just one roll of my own, and then I asked my entire department if people had paper towels to spare, and people have been generous. And you get a lot done with even just one big roll.
We have some questions in the chat. Jose, is the head cover and shoe cover part of PPE that we must wear?
So far, that's not part of the trainings I've been running, but yeah, that is something that some people have brought up, especially the little Buffon cap.
Okay, cool. Thanks. All right. Any other questions on kind of creating your own in the sim lab from materials you've got around to kind of help providers with all of this?
This is Mark Johannick from the UW Health Clinical Simulation Program in Madison, Wisconsin. We have been, we're hospital based. So if there are other sim programs out there, what we've been using for masks, we've been making our own from old drapes. So just scissors and stapler or tape, and we've been cutting them kind of to size, and then even just cutting them small to make like drawstrings or tie strings. We've got a kind of a step-by-step just pictorial guide I can send along as well.
Oh, Mark, that'd be great.
Nice.
If you want to email it to me at kadams@ssh.org, and we'll make sure we get it posted.
Will do.
Thank you.
As far as the paper towel shortage goes, I found that they make shop towels that I picked up at Harbor Freight that very similar to your kitchen variety paper towel rolls. That worked fine for us. I hate to date myself, but I had a plethora of overhead transparency film in my archive, and I use that to construct face shields.
Exactly. Yeah, that's what we're using for our face shields. Until we run out, then we're using sheet protectors, I think. That's exactly right.
Until they were found out, we filled up our inventory with things from Harbor Freight because nobody was thinking that way at the time. And I'm an old airplane mechanic, so I knew they had N95s. And man, we just bought so much stuff. But maybe a week ago now, our local community hospital just cleaned us out. They took our vents, pretty much everything we had.
Hector posted, Hector Wong, thanks Hector, asking coworkers to bring their hoarding stacks of paper towels totally works. We have the supplies, just store it at people's homes. That's good. Great discussion. Other comments? Andrew put in here a number of YouTube videos about how to fold paper to make your own masks and would suit for sim even when you can't have the real thing. Thanks, Andrew. That's great. Okay, we have a question in the chat. What are the best disinfectants to clean surfaces and equipment? Is it chlorine wipes or is it okay with a low level disinfectant for the COVID positive patient? Anybody have some experience with actual disinfection here?
Hi, this is Pooja. Can you guys hear me?
Yes, Pooja, thank you.
So the Sani wipes, the hospital-based Sani wipes, which we're using, and I'm talking about real patients because we do these lines in these COVID positive patients. The Sani wipes we ran out of. So we are using them only for goggles because if you use goggles, it will create, if bleach or Virex will create like this fog and it really becomes difficult to do the procedure. But as far as the tapper face shields go, we are using Virex. So there's a blue cloth in Virex and you squeeze it and then use your Virex solution. And the unit's divided into clean and dirty with the green and red line. And then you put your clean face shields and helmets on the other side of the unit. That's how
Pooja, Pooja, I'm going to ask you just to get a little closer to your microphone if you don't mind, and just repeat the last part of that. It was cutting off a little bit. Thank you.
Sure. Can you hear me better now?
Yes, that's better.
Okay, so we are using Virex solution with these blue cloth towels squeezed in the Virex solution for the face shields of the cappers. So we are reusing the shields of the cappers, and we use that to clean the helmet and the face shield. And the shields are being kept by the individual users. If it's the nurse, then it's the entire day, and as needed to sort of before it, you know, the part which goes on your chin that's the most friable part which can tear. But otherwise the line team, because we go and place these lines, have one face shield since we started the line team. But that's what we are using the Virex solution to clean that part.
And a couple of comments here. The CDC recommendations have been posted. Thank you, Jill. And then let's see. CAE mannequins has also been posted. Thanks, Andrew. And then Laerdal has a good page on their site for cleaning mannequins and trainers. So that's something you might want to reference as well. Ashley posted that they've been given Virex to use on all of their services to save SaniWipe supplies for those in direct patient care. Okay, great. Anything else on this? Christina noted that the cleaning problem has been a big discussion on the previous webinar as well, so we may get something pulled together on that and post in the next couple of weeks for a webinar as well. We feel like we need to keep posting these every hour. It's coming so fast and quickly. So if you're willing to help us with some of this content, don't hesitate to volunteer. We'd love to have you. Anything else on the disinfection issue before we move into making your own a little high-tech equipment? Anything else? Okay, we are lucky to have with us today Dan Raymer, who is an inventor extraordinaire who has been working in sim inventions for a long time. Dan, we had a lot of posting about sim labs using 3D printers to print some of the equipment for PPE. We've also seen a lot of chatter about SimLabs printing the devices to help split ventilators. We're going to be dealing with more of that issue next Monday on our open forum. But today we wanted to talk a little bit about the protective equipment that Dan has been working on a little bit, and other SimLabs with 3D printers might be interested in working on. So Dan, I'm going to let you talk a little bit and tell us what you're doing, what the problems are with what you're working on, and what is going well.
So yeah, so I guess my story is one of failure and disappointment, but that's always useful to learn from, I think. It's been my
Correct.
experience.
Yeah.
So I am retired, as many people know, but I used to work at Mass General Hospital in Boston, and I read in the newspaper that the president of Mass General Hospital said, people get to your 3D printers because we need respirators, N95 masks, and so please make them, and that will solve the PPE equipment problem in all of our hospitals. And I thought about that for a while and thought, well, I guess I can do my part. So it turns out that I have a little lab here in my retirement home in the garage. I'm sitting in the garage. The 3D printer is right behind me. It's currently printing a N95 mask. And so let me tell you a little bit about my experience. So here is a finished N95 mask that I've been using, actually. Very cool. So when I first decided to do this, I looked up on the web, and there are all sorts of free designs of N95 masks. And so I picked one that looked good to me, and I loaded it into my computer and then generated the file that I needed to make my 3D printer make the thing. And the first thing that bothered me is it popped up and said 2 hours and 20 minutes. So to print each mask took 2 hours and 20 minutes. The mask that gets printed, maybe I can show you up close here, is basically flat. See it printing there. And then you fold it up into the mask that looks like this. You take your hair dryer and you heat up the material, and then you can bend it, and you can actually bend it to fit your face. Well, I learned you can also burn your face when you do that, so you have to be very cautious, a little bit hazardous. It took me quite a long time to get this bent into shape and glued in place. And so, so I finished this one mask, and it took approximately 6 hours of work to make the thing. And I thought, this is not going to solve the problems of the lack of PPE equipment in our country and the world. It's cute, and it probably looks good on TV, but it really isn't a solution. I also found that there were some issues of actually making it work. And so as hard as I've tried, I cannot make this mask actually seal against my face. And as you all probably know, the coronavirus is really small, really small. A neighbor yesterday, we've been having a little cocktail party in our yard. People sit 20 feet away and have their own glass of wine. And this one woman said to me, like, where are these things? What are they? And I tried to explain to her how small a virus really is. And, you know, these viruses are about 120 nanometers. A human cell is 10,000 nanometers. So, you know, in a human cell, you can't see with your naked eye. Under a microscope, you can see it, but, you know, we're talking really, really tiny. The filters that go in N95 masks actually are, have bigger pores than the size of the virus. And so any gas that leaks around the side on inhalation can come in substantial quantities. A droplet of moisture is on the order of 100 times or up to 1,000 times larger than a virus. And so thousands of virus particles can sit on a water droplet that can hang in the air for hours. And so in order to make an effective N95 mask, you have to be really, really precise and have edges that meet perfectly. 3D printing is wonderful for making prototypes, but it's not so great for making finished products. So N95 masks are made from molds. They make thousands of them an hour. I can make a sixth of a mask in an hour. And so the only use for this, two uses I found for this, are going to the grocery store, which makes a pretty good statement about don't come near me. And it's probably pretty good for simulation. And so making things like this to simulate materials, as Jose was talking about, that are a little bit neater and cleaner than the masking tape model, I think is a practical thing. If you have a 3D printer, you can probably do that. But I really don't think that this is a panacea.
What are some comments for Dan, others of you that have been working on this and trying some of these things? We're getting some discussion. Sorry, I asked a question and then just jump right in, but what material is a 3D printed mask made of? PLA is recommended. Dan is correct, efficacy is hard to prove without extensive testing. Dan, is that what you're using?
Yeah, so this is PLA, absolutely.
Mm-hmm. With this type
3D
of
printers, of course, 3D printers can come in all sorts of sizes and shapes and costs. They have different resolutions. They can print things. Some of them can print things that are very thin. Some can print things that are very big. And so a lot depends on the 3D printer that you have. Mine's a pretty expensive one, a pretty good one, and it prints fairly fast, but not that fast.
We had a question, Dan. Would this type of 3D printed mask be roughly equivalent to a standard surgical mask from a protection standpoint?
So the thing about N95 masks is they often have a filter in the part that you breathe through. So this comes off and you put a filter in there. And so the type of filter that you use determines how good the filtration is. And so a surgical mask filters at 0.3 microns pretty well, 95% effective at 0.3 microns. And even though that's a little bit bigger than a virus, the viruses do get hung up in that size pore. And so they're pretty effective. If you cut a piece of surgical mask and put it in there, that's considered to be pretty effective. Alternatively, you can use a vacuum cleaner HEPA filter. They're as effective as surgical masks, but they're harder to breathe through. And then you can certainly use things like lab filters or even t-shirt material. Cotton actually seems to filter fairly well. It's 50% effective instead of 95% effective. But finding the right material that works for whatever mask that you print takes a little bit of work, and that will determine how good it is. But of course, if you're making these in your garage like I am, you don't really have a way to test them that would meet CDC or FDA requirements. And so, yeah, you can put a filter in there that seems like it's the right one, that's really a HEPA filter at 0.3 microns, but the leakage around it may be such that it isn't really working the way that you think it is. And so, I've, I tried really hard. I have silicone around the edges so that it seals better. I've got some where I put the silicone all the way around. That's what's up against your face. It's comfortable, but I can still feel some leakage around them. Whereas I happen to have an old N95 mask for painting, and this one's much more comfortable, feels a lot better, and was manufactured, I believe, in China by the thousands.
All right. Other comments for Dan? We've got a lot going on in the chat box, but I'll be quiet for a minute and let all of you, anyone that wants to unmute and contribute.
So I see Sigrid has a great question there about keeping these things clean if you use them for simulation in situ, and I think that's a really big issue. The nice thing about things like this that makes it easy is that you can disinfect this pretty easily. Chlorine-based cleaning solutions or isopropyl alcohol, you can put all over this and it won't harm anything. But if it's a piece of cloth or a piece of paper towel, I think you might have a problem there.
Hey, this is Jose. Just in response to that question, part of the design I had for all these were things that we could make pretty quickly and that were single use for single learner, because you know that was on everybody's mind. So we give it to a learner for a training, they throw it out when they're done. So we're just kicking out as many as we can.
Good point. Elizabeth says, why not make a plastic shield go over a surgical mask? That's what our college has done with our printers. What are people thinking?
Yeah, I think that's real interesting, and that's that's a fairly easy. You could make the plastic part with a 3D printer, and then put a piece of clear plastic glued to it or bolted to it in some way. I think that's a nice application. I thought it was really interesting. I read an article by a virologist who said that coronavirus cannot enter through the eyes. And so protection of the nares and the mouth what was really important. And so I went online and looked up what's known about the transmission of coronavirus through the eyes. And it turns out it really hasn't been studied. And there's some articles in the ophthalmology literature that make some analogies from some infections that occur mostly in animals, but no one really knows whether that's a legitimate concern. I'm not suggesting that people shouldn't wear face shields or goggles. I think they should, but it may not be the most important part of this.
Mm-hmm. Bob asked a question, anybody using hydrogen peroxide or UV light to clean disposable N95s? Looks like the University of Minnesota is. Sam, can you tell us a little bit more about that? Can you speak, or are you able to?
I can just mention, really, it was mentioned from the dean of the medical school that this is being looked into right now.
Okay.
But as far as I know, they don't have an official recommendation on that yet. I think they were hoping to come to a conclusion by the end of the week, if not early next week on that.
Yeah, this is Bob Armstrong. The hospital across the street from us, our teaching hospital, Sentara Norfolk General, was actually doing that with UV light. They were investigating the hydrogen peroxide approach too, but they're using a UV light sanitation so that individuals can reuse their masks, these disposable masks. So I'll try to get some more info on that, see if I can share it to the I don't know, Kathy, whatever's the best way to share it, but as I understand it, Sentara was really happy with the results they were getting from it.
Yeah, just send it on to us, Bob. We're trying to get all these resources for each webinar posted in a resource list. Andrew's been helping us with that. So go ahead and send that along. That'd be great. Any other comments on creating equipment for training and disinfecting equipment for training? What have some of you been experiencing in terms of the quick ramp up here? How are sim centers being tapped to provide PPE right now? Is anybody willing to share their story and how things are going?
Hi, this is Carla from Michigan. We donated as much as we could possibly donate, and they're currently making, well, we have made our simulation center into a alternate care site. No one has been admitted to it quite yet, but the last of the supplies are going in today. So they do have a fair amount, but they'd probably be done with that in about an 8-hour shift.
Were you called on, Carla, to do any training for PPE in the sim lab, or was that just all handled on the clinical side once everybody started to realize what was coming here?
We haven't been as far as the clinical side, but we're a university that, of course, has all the students. And so the PPE site that we were allowed to share has been used like in various different classes already, and probably will be used for the summer as well.
Okay. What have others been experiencing on this? Lots of good things getting posted here. We'll try to capture for everybody. Okay. We'll continue to compile all of these training resources and articles and things to kind of help people keep this discussion moving forward. That'll be posted on the SSIH COVID-19 website. I will share my screen here so you can see that. It's getting pretty full of resources, but we encourage all of you to go and find that. It is free for everyone. I need to get my share screen here.
Kathy?
Yeah.
This is Becky DeMazzo.
Hi, Becky.
Hi. Hey, so we were asked to also to donate to the hospital, and we were quite concerned that that process be safe. And one of the things that we've done is use Dan Raymer's stickers about not for human use stickers, and actually put them over the doors that contain equipment that like are fake meds and stuff like that, because the hospital has access to our site, and since we're not staffing it full-time anymore, we don't want someone coming in and shopping among our things, not knowing what's good and what's not. So we've actually posted those stickers so that if somebody enters the room, they have to break a sticker to get in the room, so we'll know. And we've got everything marked as well as we could ahead of time, but I feel a lot better feeling like I have some control over that, just trying to prevent unnecessary things going to the hospital, things that won't benefit them.
It's a great point. A lot of you have been having to donate your equipment. So feel free to chime in here. Becky brings up a great point.
Hey, Kathy, this is William Belk with Air Methods. We've done something very similar. There is one of those stickers or some variation of that sticker on everything in my training facilities. Luckily, we're not hospital-based, we're medical, and so my crews don't necessarily have access to our training centers, but all of our PPE has been shifted out of the training centers out to the base level where it was needed, since we don't really need that in the lab.
Great, thank you. Other thoughts, other ideas. This is how you can submit COVID-19 resources to the community right here. Go to ssh.org and click on our COVID-19 page, and then go all the way to the bottom of the resources page. And you'll be able to submit the URL, source, tell us what it's about, and your email. Our marketing team has been adding to this daily and will continue to do so. So please keep sending us on these ideas and references. We'll go ahead and post the PowerPoint that Jose gave us. We'll post the E-Train link, and other things that we've been gathering in the chat box. That give us a day or so and we'll try to get all of that online. The recording for this webinar will be up on our SSH YouTube channel, and the chat does go along with the recording, so you'll be able to go in and find things that were posted during the discussion as well. Anything else that we could we've got a few minutes left. If anyone would like to talk about any other items related to PPE, we'd be happy to hear it. Okay. Thanks, everyone. We'll be back online again on Monday at 2 Eastern, 11 a.m. Pacific with an open forum. We're working on developing some of the content. That open forum is designed to let anybody with challenges associated with the COVID transition for SIM programs to hop on and talk through issues and share with other colleagues. We are going to begin talking about the ventilator splitting discussions that are going on. We did get into that a little bit on last Monday's call. There have been several teams that have been working on splitting ventilators. I know it's becoming quickly a very hot topic, and so we are going to try to get some more conversation going on that on Monday. Have a great weekend, everyone, and stay safe. Thanks for joining us.
Thank you,
Kathy.
Thanks, Kathy. Great job.
Thanks, everybody.
Thank you.
Thank you.
Thank you. Thank you.
Thanks.